Video, we're going to talk about some strategies to facilitate peer interaction in inclusive environments. This can be tricky at times, and it's important to follow the guidelines of the location that you're in. Some general things to keep in mind is that children with disabilities are at a greater risk of being bullied, and so you really just want to do everything you can to help with that. So teaching other children person-first language, you should intervene at any sign of bullying, and you should encourage other children to do the same. You should teach the other children to all share and accept each other's differences, help children understand and relate to their peers. This can be used in any situations. If you have conflict, help them see through the other person's eyes. So you could use phrases such as, you know how this is difficult for you, this is difficult for them. So just helping to facilitate that understanding. And then as well as educating children about disability and inclusion so they can see what effects they have and what they can do. What we're going to talk about is based off of Baylor's Masters in Social Work program. We have just a couple of strategies for different ages when educating children about disabilities. So when you have younger kids from ages 5 to 9, you want to focus on concrete thinking, so facts rather than imaginations or implicit bias. So avoiding abstract comparisons, you just want to be very direct with them when you're talking about disability. Identify distinct differences and similarities. So if they're interacting with a child with a disability, you can say, yeah, you're different in this way, but you both like to do this, or just really finding what similarities they have and explaining those to them so that they can see that for themselves. You want to encourage younger children to introduce themselves and just engage in conversation. And then they're going to have a lot of questions, so you really want to encourage them to balance their curiosity with respect. So encourage them to ask questions, but explain to them what impacts they can have and that they need to be thoughtful and respectful in their questions and interactions. For children's age 10 to 11, you can focus more on emotional thinking, so associating feelings with specific experiences. So you have explained to them what's going on, and you really want to dig in with them a bit, unpack how they're feeling after an interaction with someone new. So you can bring up those specific instances that they're not sure about or that they have questions about and talk through those with them. You can address if they have any conflicted feelings. So if they feel like they're being judged for being inclusive of others, you can talk about that and their priorities over social perceptions versus social goods. So really just diving into that and helping them understand just the different factors at play with that. And again, you want to normalize confusion so that it's okay to feel confused and to ask questions, but you really just want to focus on some main points, which are the maintaining respect and considering how others feel, even if it makes you uncomfortable, just really doing what you can to not be disrespectful. And you can talk about different social structures. So you're talking about why it is harmful to exclude others because of perceived differences. You can talk about the positive aspects of including others and just what that means sort of overall. In older children, 12 to 17, this is where you can focus on empathy and kindness. So really encouraging them to invite others into their friend groups, to intervene when they see bullying, and be on the lookout for peers at risk of isolation. Most children will want to be helpful and be that advocate for others. So you really want to maximize on that and help them understand if they're getting caught up in little things such as feeling excluded by their friends because they're being inclusive, just helping them talk through that and being a support for them as they go through any of that conflict. Address social exclusion, so explaining how isolation can cause signs of depression and anxiety, and this can happen in online settings such as social media as well as in person. So helping them realize the impacts it can have and what they can look out for. Discussing individual differences, how to identify and share their own differences. And then you can get a bit more into what disability is with this age group, talking about different disabilities that exist and using the social model when you're explaining it, really helping them understand how barriers can create disability in the design of the environment and the attitudes of others. Another strategy that you can use to facilitate peer interaction is called behavioral interpretation. This is based off of a article that I found in my research, and essentially what it is providing spoken meaning for a child's behavior with the intent to inform others. So it's an approach based on supports. It is implemented by the counselor or the in this case, it was the director of the class, and you're as that role, you're providing a model for the other children to imitate. This strategy includes scaffolding, direct prompts, positive reinforcement, and environmental arrangement. Scaffolding is breaking down the lesson or what you're teaching down into chunks to make it easier, and then the rest is self-explanatory. With positive reinforcement, you want to reward positive behavior and then arrange the environment in a way that is accessible for all. So in this study, it was applied within the context of a music program. The included one boy with autism named Aaron and 4 other participants, and they're basically enrolled in this class in which they're learning about music and trying out different instruments. Throughout the session, the instructor provides spoken meaning to Aaron's actions that may not make sense to his peers. So the instructor uses phrases such as, I think he wants, maybe it's too loud for him, etc., and makes it clear that she's not speaking for Aaron. So she's not saying he wants this or it's too loud for him. She's providing spoken meaning to how she's perceiving his behavior. And then with this implementation, the day after it was implemented, the other children were beginning to apply it as well, noting his eye gaze on his visual board, which they had not followed before. And so we're going to talk about some specific examples that are very heavily based off of this article on how to implement behavioral interpretation. So in the first scenario, the children were playing with their flutes before they were going to learn a song. While Lucy is talking, Aaron sets his flute on her lap and looks at his picture book. So this image is what I mentioned on the last slide as well, a visual board, which is what this is. It's essentially a communication device that has pictures and words that Aaron, in this instance, uses to communicate. He uses it by looking at which one he is trying to say or pointing at it. So in this example, he set his flute in the girl beside his lap and looked at his picture book. So the instructor, when intervening here, said maybe he wants a different instrument, or maybe he wants to hear you play because of him setting it into her lap. In the second example, Thomas, one of the other students, is getting ready to conduct a song with the rest of the children. Bella has a keyboard. As the song is about to begin, Erin taps on her hand, pushing the keys on the keyboard. And implementing in this, you could say something like, it seems like he wants Bella to play the keyboard. So again, just providing that meaning to what he's doing, as these are actions that would typically confuse a child that doesn't understand why he's doing what he's doing, and providing this meaning to it helps them to begin to think about what they think he means by things and helping to facilitate that interaction. In the third example, the children begin playing a song on their various instruments. The instructor is conducting and signals the children to increase the volume of their playing. As they do so, Aaron stops playing and covers his ears. So in this instance, the instructor could say, "It might be too loud for him. Maybe you can ask Aaron if it's too loud by using his visual board." So in this one, he's not only providing the meaning to his actions, he's also encouraging the other children to communicate with Aaron with the visual board. In the fourth example, the instructor allows each child to pick which instrument they would like to play next. Each child is asked one by one which instrument they would like. When it's Aaron's turn, he looks at his visual board. So in this case, you could say, "I see Aaron looking at the guitar. It seems that he would like to play the guitar for this song." So because it seemed that he was looking at the guitar on his visual board, again, that's facilitating the use of that visual board for communication. And then the final example, the instructor announces that the next song that the group is going to be learning. Aaron begins jumping up and down while waving his arms. The instructor says it looks like Aaron knows the song and is very excited to learn it. So again, providing an interpretation to what that behavior means. And then in this specific study, the other children began to model the instructor's behavior a day after the behavioral interpretation was implemented. They felt more comfortable using Aaron's visual board when communicating with him and verbalizing how they interpreted his actions. So overall, implementing behavioral interpretation can be a great start to facilitating that peer interaction and limiting barriers and isolation that comes from negative attitudes and a lack of interaction. So in the next video, we're going to briefly talk about two different models that can be used to assess a child's support needs in their various environments and activities.